In this video, I'm going to show you how to assess regional and segmental intervertebral motion of the mid-cervical spine in flexion in sitting position.
Get our very own assessment ebook and mobile app. Links are in the video description.
Hi and welcome back to Physiotutors. Passive assessment of the quantity and quality of segmental intervertebral motion, also known as motion palpation, is part of the diagnostic clinical expertise of manual practitioners to guide decisions on a therapeutic strategy for patients with spinal pain. Hypomobility indicates mobilizing interventions, while hypermobility calls for a stabilizing approach. A systematic review done by Van Trijfel et al. In the year 2005 evaluated the reliability of passive segmental assessment of the cervical spine and found an overall reliability of poor to fair. For this reason, the clinical value of passive mid-cervical spine assessment is rather weak. In order to perform regional range of motion assessment for mid-cervical spine flexion of vertebrae C2 till C7, have your patient sit upright at the edge of the bench or on a stool while the examiner stands on the contralateral side to be examined. The bench height should be adjusted so that your patient's head is at the same height as your sternum. First, fixate the spinous process of C2 with one hand and rotate the upper cervical spine via the patient's occiput until you feel resistance. Then your working hand is moved down onto C2 so that your pinky and hypothenar eminence make contact with the contralateral arch of C2. By supinating the forearm and opening your hand, you can make sure that no movement will take place above C2. The patient's head is fixated between the working hand and your chest. Then fixate your patient's vertebrae C7 with your other hand with a key grip into ventrocaudal direction. Now perform a maximal homonymous 3D movement with equal components of flexion, ipsilateral, lateral flexion and ipsilateral rotation. This movement causes maximal opening of the facet joints of C2 till C7 on the contralateral side. The whole movement is judged on resistance during motion and at end range, range of motion, as well as possible pain provocation compared to the other side. In order to continue with segmental assessment, have your patient sit straight again and first rotate the upper cervical spine until you feel resistance. To test segmental motion of C2, C3, your working hand is placed onto the contralateral arch of C2 and your fixating hand is now placed on the spinous process of C3 with a key grip into ventrocaudal direction. Then perform a maximal homonymous 3D movement with equal components of flexion, ipsilateral, lateral flexion and ipsilateral rotation again. To test each component of intervertebral motion, slightly move out of the end range and now test flexion between C2 and C3 by pushing the spinous process of C3 ventrocaudally with your fixating hand. To assess rotation, keep your fixation and rotate further or push the ipsilateral arch of C3 ventrally with your thumb. And for the lateral flexion component, keep C3 fixated and move C2 laterally with your working hand. Each component is judged on resistance during motion and feel, as well as possible pain provocation compared to the segment above or below. In order to assess the lower segments, move your fixating hand down on C4 with your working hand on the contralateral arch of C3 and perform a 3D flexion movement and continue this way until you reach C7 with your fixating hand. Alright, this was our video on intervertebral motion assessment of the mid-cervical spine in flexion in sitting position. If you want to learn how to assess intervertebral motion assessment of the mid-cervical spine in flexion in supine position, click on the video right next to me. Thank you very much for watching. Feel free to give this video a like if it was helpful to you and share it. Click on the subscribe button if you haven't yet and on the little bell icon next to it in order not to miss any future videos. This was Kai for Physiotutors. I'll see you in the next video. Bye.